Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary for the medical knowledge to general people and for reference to medicals. Today I am going to discuss about the diabetes mellitus, diagnosis and treatment. Diabetes mellitus is a chronic condition that affects the body's ability to use the energy found in the food. The cells in the body needs insulin, a hormone in the blood, to take in the glucose and use it for energy. Normally, body breaks down the sugars and the carbohydrates into smaller form of sugars. In diabetes, the body does not make enough of insulin, or it can't utilize the insulin available or combination of both. High levels of blood glucose can damage the tiny blood vessels in the kidney, heart, eyes and nervous system. Types. There are three types of diabetes: type 1 diabetes, type 2 diabetes and gestational diabetes. Type 1 diabetes, it is also called insulin dependent diabetes or juvenile diabetes. It usually begins in younger age. It is thought to be an autoimmune condition. Here the insulin is not formed. It may be caused by the genetic predisposition. The faulty beta cells, islets of Langerhans in the pancreas, which usually produce insulin, does not produce insulin. Risks are as a result of the damage to the small blood vessels of eyes, retinopathy, nerves, neuropathy and kidneys, nephropathy, heart disease and stroke. Treatment involves taking of insulin, which needs to be injected into the subcutaneous fat. Methods of injection: syringes, by injecting measured units of insulin with syringe. Insulin pens, having a pre-filled cartridges and a fine needle. Jet injectors, used with high pressure air to send a spray of insulin through the skin. Insulin pumps, dispense the insulin through the flexible tubing to a catheter under the skin of the abdomen. Type 2 diabetes, it is also called non-insulin dependent diabetes, NIDDM, or adult onset diabetes, results from the insulin resistance, a condition in which cells fail to respond to insulin properly. As the disease progresses, a lack of insulin may develop. Primary cause is obesity and lack of exercise. Treatment: weight management, nutrition and exercise are enough to control type 2 diabetes in initial stages. As it progresses, oral medication may be needed. Gestational diabetes, diabetes seen in type 2 or third trimester, second or third trimester, as the gestation sometimes leads to insulin resistance. High blood sugar levels in a mother are circulated to the body through placenta. It must be controlled to protect the growth and development of the baby. It resolves after delivery but may recur after some time though there is no pregnancy. Risk factors: to the mother, may need cesarean section due to large baby and common effects to eye effect to the baby. Abnormal weight gain before birth, breathing problems, obesity and diabetes or after birth. Symptoms of all types: weight loss due to non-availability of calories, polyuria, frequent urination, polydipsia, secondary to loss of water, polyphagia, increased hunger due to non-availability of glucose to the brain. Symptoms rapidly develop in type 1 diabetes mellitus and very slowly in type 2. Other symptoms include blurry vision, headache, fatigue, slow healing of cuts, diabetic dermatosis, different skin rashes. Diagnosis: fasting blood sugar after 8 hours of fasting. Normal range 65 to 110 milligrams per year. Post lunch after 2 hours of taking food, normal range 80 to 140 year. Glycated hemoglobin to find cardiac risks. Management: there is no cure for diabetes mellitus, only management is to be considered. Diet: with less of sugars is recommended. Exercises play an active role in controlling the blood sugar. Medication includes insulin in type 1 diabetes and oral medication and insulin in type 2 diabetes. That's all about the diabetes mellitus diagnosis and treatment. And in the next video I will discuss about some other disease. Thank you.